Good morning and welcome to this morning's combined grand rounds from the Department of Obstetrics and Gynecology and the Department of Pediatrics. I'm Judy Burgess from the Department of Obstetrics and Gynecology, and I'm happy to introduce this morning's speaker. We're fortunate to have Dr. Nick Fogelson here. Dr. Fogelson is an assistant professor with our department. He received his undergraduate degree at the University of Oregon. He's a duck. And then his medical school was at the University of Oregon for Health Sciences. He did his residency in Charleston at the Medical University of South Carolina. He has had clinical faculty appointments at the University of Hawaii, at the Medical University, and we have been fortunate enough to have him here since 2009. Right? 2009. Today, well, let me start. He's got a lot of interest. He's interested in minimally invasive GYN surgery. He's interested in the internet and how it can be used to give medical information freely between professionals. And he's going to talk to us today about another one of his interest areas, delayed cord clamping in term and preterm neonates. So join me in welcoming Dr. Fogelson.
Well, thanks a lot for coming. I think this will be an interesting topic, and I always believe in interaction between the audience and interaction in presentations. And this presentation is intentionally a little shorter than your normal grand rounds because I really hope that there's some discussion afterwards, because some of the data I'm going to present I think is definitely worth discussing because it really affects us. And when I give grand rounds, I really like to talk about something that might actually change people's practice, and I hope that today you'll get some information that may, if you're an obstetrician gynecologist, may change a little bit about what you do, or if you're a pediatrician, change a little bit of how you look at these things too. This is an interesting topic I want to talk about. It has to do with the umbilical cord after a baby's born and when we should clamp it, or should we clamp it, should we not clamp it, what should we be doing? And I got interested in this topic really off of something that Judy was saying, which is that I had a patient at the University of Hawaii that came to me, and she was a person who believed in natural labor, natural birth, and she had all kinds of things that she wanted me to do, and some of them sound kind of unusual to me. And one of them is she told me, I really don't want you to clamp the umbilical cord until it stops pulsating. And at that time, I didn't think much of it, but I was like, okay. I don't really think it does, and I don't really think it matters, but I'm happy to do it. It doesn't bother me. And so I did that, and she was happy, and I didn't really think too much about it. But at the same time, I was starting something on the internet, and it was called Academic OBGYN. And Academic OBGYN is a blog that I've created, and I initially intended to communicate with other physicians with Academic OBGYN, and I do communicate with other physicians, but actually I found that about 80% of the traffic actually comes from lay people. As things are on the internet, people will find things on Google, and a lot of lay people come to the blog and they learn things and make comments about what they think about OBGYN or various questions they have, and we try to interact. And one of the things I found that people were very interested in was when the umbilical cord is clamped. And it wasn't something that I was that interested in, but I found out that a lot of people out there are very interested in this. And here's just a few things that you can find just in the last few months. Don't clamp the umbilical cord straight after birth. Delayed cord clamping should be standard practice. Doing clamp the umbilical cord too soon. Early clamping may interrupt humankind's first natural stem cell transplant. Delayed cord clamping may benefit at-risk infants. And this is just a sample. If you were to Google this topic, you could really find hundreds of posts. And so there's a huge amount of interest out there amongst lay people, and a lot of people that really believe that this is important. Does anyone seen this picture before? This is an amphora that was found in Greece, and of course is a stamp. This is a Greek stamp. But this is the only picture of a particular physician that we have on an amphora, and this physician's name is Iatros. And does anyone know where we get Iatros? What do we use Iatros for? What's that? Iatrogenic. Iatrogenic means things that doctors do to patients accidentally. Okay, what's Iatros doing? Does anyone tell what Iatros is doing in this painting? Yes, he's bloodletting someone. Okay, and this is exactly where, this is the only picture we have of Iatros, and this is where the word iatrogenic comes from, is that Iatros is known for bloodletting his patients. And of course, I'm sure he was a physician in Greece and did everything that Greek physicians did, but back then they believed that bloodletting was helpful. In fact, we believed that for a long time. In fact, the first president of the United States was basically murdered by bloodletting when they removed 1.8 liters of his blood when he was suffering from severe pneumonia. which would be quite damaging to someone we know now. But George Washington said, I need to be bloodlet so I don't die from this pneumonia, and ultimately he was bloodlet 3 or 4 times prior to his death. So it's interesting that I talk about bloodletting and then talk about immediate versus delayed cord clamping, because I think that you'll see a bit of a parallel. I want to show you a little bit about what happens to the umbilical cord outside of humans, because we're the only species that does this thing where we clamp umbilical cords. There's no other species that does this. And I'd really like you to keep in mind today what would happen if there were no obstetricians, what would happen if there were no family medicine doctors or people there deciding they need to do something with the umbilical cord. So let's show you a little bit about what happens with some other species. Here's a cat that's just delivered a little kitten, and it's sitting there close to mother. It's getting its heat from the mother, and we'll see what the cat does. You don't see a lot of attention on the umbilical cord. Cat's just licking the kitten, keeping it warm, and if you see, not quite dark enough, but you can see the umbilical cord up there on the left, and not a whole lot of attention at getting that sucker clamped. And everything, I've had kittens before, or my cat has had kittens, and my cat has had kittens, and when I found them, the placenta was gone, and I bet I imagine the cat did not eat the placenta until well after the kittens were born, because when I came back, there was no placenta. How about a little bit of a higher mammal? Here's a horse. And you can see that the amniotic sac has ruptured, and we're going to get an obstetrician involved here, feeling like they have to pull on the baby. Certainly can't just let it come out. So, and we have a horse having a foal. And there you see a big fat umbilical cord. And again, this is a little bit of time lapse. Obviously this has been a little while, and that umbilical cord is left there. Again, another species that doesn't seem to have a lot of desire to clamp an umbilical cord. Again, umbilical cord is still there. We're probably 10, 20 minutes into this, and the horse is starting to get up and still pumping blood through the placenta as much as it can, still getting an opportunity to get whatever blood out of the placenta to the horse as can get there. How about we go a little further up to something that's a lot closer to us? Is it an orangutan? And here's something that we cannot do. We're unable to completely envelop the infant's head in our mouth in the way that an orangutan can. But you can see the same thing, not unlike the cat. The orangutan is licking the baby, keeping it warm, bonding with the baby, and the umbilical cord is not a major issue. We'll have a little more video, and you can see there the intact umbilical cord still there. We'll do something with it eventually after we're done licking the tasty amniotic fluid. So, but you get into higher primates, we have this. This baby's just been born. We have invented a technology so that we can clamp it even faster, and one-handed umbilical cord clamping, there you go. That fast. And that's what we do. So, not to say all mammals. Here's one mammal that seems to go ahead and cut its cord. Bam, cord's cut instantly. The only animal, by the way, that's born with its complete agility. Cetaceans are born with what seems to be adult agility the moment they're born, as opposed to every other mammal that's born rather feeble. Cetaceans are born and they swim right away. But outside of cetaceans, we're the only animal that does this. And I would claim that we don't do it because we really think that it's a good idea, or that we really have any conscious thought that we really need to clamp the umbilical cord right away. I think we do it because it's just a development of our technology. It's a development of the way that we deliver babies. I think if you go back a few hundred years, you know, there wasn't a pediatrician there, there wasn't a warmer there was a mother, there was a blanket, there was a breast. The baby was born, and put on the mother's belly, and there was no real reason to clamp the umbilical cord right away. But now we have a warmer, we have nurses, we have all kinds of things, and it seems awfully convenient that let's just clamp the umbilical cord and get the baby to the warmer, and people don't really think about it. And I think there's a few people that have ideas that somehow they're doing something useful by clamping the cord, but I think most people just do it completely routinely without even thinking about it. Well, this is something that's been thought of for a long time. This is Erasmus Darwin. He is the grandfather of Charles Darwin of The Origin of Species. And he said another thing very injurious to the child is the tying and the cutting of the umbilical string, navel string of the umbilical cord, which should always be left till the child has not only repeatedly breathed, but till all pulsation in the cord ceases, as otherwise the child is much weaker than it ought to be, a portion of the blood being left in the placenta, which ought to have been in the child. And this is quite accurate, as I will show you. And this was written in 1801. This was a major medical textbook of that time. So what I'd like to do today is answer a couple questions. Does early clamping the umbilical cord have any physiologic impact to the infant? Am I just completely talking nonsense and it really doesn't matter, and this is a bunch of natural birthing nonsense that they all care about and it doesn't make any difference? Or is there really a physiologic impact that we should care about? And does early umbilical cord clamping have a clinical impact? Because if it makes some difference in the labs and it makes some difference in, measurable physiology, but it has no impact on clinical outcomes, then it really shouldn't matter either. So those are really the two important questions to answer. And there's actually a lot of literature on this. And what I want to do today is just do a little bit of a literature review with you and show you the seminal articles that describe this data and see if you agree that maybe we shouldn't clamp umbilical cords so quickly. So we're going to talk about cord physiology and placental transfusion first. And then we'll talk about the clinical impact of immediate versus delayed cord clamping. And then we'll talk about some of the theoretical benefits of placental transfusion. Now, it's interesting when you look at papers. Basically, if a paper has been published prior to when it would be available in PDF online, it doesn't exist, right? Because who's going to go to the library and go and photocopy an article anymore? It's basically never happens. Now, fortunately, I have a secretary that was able to get these things for me, but a lot of these articles well predate anything that you would be able to get online. And so if you were to search for this, you'd only get modern articles. But here's an article. That was a real major article. It was written in 1963 by Robert Usher, Michael Shepard, and John Lind. This is in Acta Pediatrica, which is a Scandinavian journal. And they looked at a number of infants, 27 term infants, and they wanted to know does it matter when you clamp the umbilical cord early or late, does it change the blood volume of the infant? Because the theory would be that a substantial amount of that blood that's in the umbilical cord and in the placenta, if the cord is not immediately clamped, that a lot of that blood is going to end up in the baby. And so the question, is that true? So they took a number of infants, they clamped 9 of them immediately, they clamped 11 of them at 5 minutes, and then 7 of them, they stripped the umbilical cord every 30 seconds and then clamped it. So, and then they did something that we would never do today. They injected radioactive iodine into the infants, and then they measured the radioactive iodine concentration in the infants, and by doing that, they were able to determine the neonate's blood volume. I don't think that would pass IRB today. And this is what they found. I'm going to use the pointer so it'll appear on the, let's see. Oh, I guess I can't. Okay, I have a pointer, but it's not going to show up on the recording, unfortunately. But I'll talk through it. On the bottom here, you have the age since the baby's been born. So quarter of an hour, half an hour, 1 hour, 2 hours, and so forth. Over here, you have milliliters per kilogram of blood volume in the infant, so based on a kilogram of the infant. This bottom line is infants that had their umbilical cord clamped immediately. This line that ends up on the bottom here is infants that had their cord stripped. And then this one on the top are infants that had delayed cord clamping. And you can immediately see that the volume of these infants is quite different. At 1 hour of birth, you see an average of 78 milliliters per kilogram of blood versus about 100 milliliters per kilogram of blood. That's almost 50%. It's about a 40% difference in the neonate's blood volume. So you substantially change the neonate's blood volume. And I think the more radical of the people that believe in this would say that by clamping the umbilical cord, you phlebotomize the baby of 40 milliliters, 40% of its blood volume. Now, if you were to remove 40% of the blood volume of an adult, you'd put the adult in shock. And yet neonates seem to be able to tolerate this, and yet we routinely remove 40% of the blood that they would have had if they'd been on the umbilical cord for 3 minutes. Seems pretty substantial. And if you go out to 24 hours or 48 hours, we still see a substantial difference. Even though the baby is going to start third spacing fluid, it's going to start urinating and doing things to kind of normalize itself, we still see